Hi, my name is Emma, and I have a question.
Hi, I'm Brianna. I'm 8 years old.
Hello, I'm Jacob Klein from Kamoka, Ontario.
Hi, my name is Christy. I'm 5.
A few weeks ago, we did an episode answering your top coronavirus questions. And since then, so much has changed in terms of what we know about the virus and the impact that it's had on our lives. A lot of people have continued to send in their questions, and Global News recently did a call out for kids to send in theirs. A whole bunch of responses came in, and they're not as easy to answer as you might think. So if you've had trouble answering your kids' questions about COVID-19 and all the big changes that they might be dealing with right now, we're hoping this episode helps a bit, and maybe you want to listen to it together. Global's Jeff Semple is back on the show for your top coronavirus questions, Kids Edition. I'm Tamara Kandaker, and you're listening to Wait, There's More. Hey, Jeff, how's it going?
I'm okay, all things considered. How are you doing?
Good. Very good to have you back. So we've been getting a lot of questions from kids about the coronavirus, and some of these questions are very good.
Yeah, it's great to be back with you. And as any parent knows, kids ask a lot of questions, but often really good questions that either mom and dad hadn't thought of or maybe were too embarrassed to ask. So yeah, we were really pleased. We put out the call and asked kids to send in their questions, and we got a lot of great questions.
Okay, so let's just dive right into it. I'm going to group some similar ones together, and I'll probably ask you some follow-ups about things that I'm curious about. All right, this is our first question.
How did COVID-19 start?
Hi, my name is Olivia and I live in Richmond, BC. My question about COVID-19 is it a new virus or has it been around for a long time? And if it is a new virus, where did it come from?
So Jeff, how did the virus start? How did it get on this earth?
Yeah, so at this point, we don't know exactly how this coronavirus started. It's believed to have originated in Wuhan, China. The suspicion still is, suspect number one is this live animal market where you have, a lot of animals there and a lot of people. So we're thinking that it started in a bat and made the leap to humans, but at this point we still don't know for sure.
And if it did start in a bat, how could it have made the leap from a bat to a human?
Yeah, again, we don't know for certain, but it's possible that the bat came into contact with a person either potentially by biting them, perhaps someone ate part of a bat. We really don't know. But yeah, we've seen this sort of thing happen before, and at this point it remains part of the mystery as to how this thing started.
All right, so the next questions are about symptoms.
Why is the virus so scary and what does it feel like?
Hi, my name is Rakshan and my question is, how does it feel like having the virus?
Okay, so Jeff, why is the virus so scary and how does it make you feel?
Well, this virus is scary because, first of all, it's really contagious. So, on average, each person is infecting at least 2 other people. So it's really contagious. That's the first part. So you have a hard time breathing, you have a dry cough, and you have a fever. So you're feeling really, really warm. Those are sort of the main 3 symptoms, but they're not the only symptoms. And that's part of what makes this virus so tough as well, is that the symptoms can range quite a bit. So some people have, diarrhea. Other people have reported losing their sense of smell or taste, which isn't unusual for a respiratory virus like this, actually. It affects the sensors in our respiratory system that are responsible for your sense of smell. And so, suddenly you can't smell and taste very much. I talked to a woman yesterday in her 70s who just recovered from COVID-19, who said that one of her first symptoms, she was having a cup of coffee and couldn't taste it. She was so confused. She's like, I can't taste this cup of bold coffee. So that's one that we've been hearing more about. And the scariest symptom of all is that it just sounds like for a lot of people, it's really hard to breathe. So I talked to one young guy in his mid-30s who said that he has asthma. And when he's trying to breathe with asthma, it's more of a wheezing, like he's trying to take a breath in and he can, but it's a wheezing sort of breath, right? But with COVID-19, he says he feels like he can't breathe in at all. And when you feel like you can't breathe, that's a scary feeling.
Okay, so those are the symptoms. And I think we have a related question.
How long does it take you to know how long you have the coronavirus? Like, how long does it take you to get the coronavirus?
What do you think?
Yeah, so that's another great question. And starting with how long does it take to find out, that really depends. But we know that this virus has what's called an incubation period of between 1 and 14 days. So that means that if you get sick, it's going to take a maximum of 14 days before you start to feel sick. But for most people, if once you get sick, it's, say a few days, 4 or 5, 6 days, and then you start to feel sick. And, the symptoms, as we've discussed, are that fever, that dry cough, usually having a bit of a tough time breathing. You're feeling really tired, right? We've talked to people who were trying to do chores around the house and just couldn't, trying to sweep some dust off the floor and just really out of breath and had to go lie down. So yeah, if you start to feel like that, and especially, maybe say 5 or 6 days ago, you were out with your friends or were out somewhere where you might have been exposed to the virus and you're thinking, oh man, that was like 4 or 5 days ago. Now I'm feeling like I've got a fever and I'm feeling really tired and I'm having this dry cough, then you're going to want to talk to your parents right away.
So talk to your parents if you start to feel bad. And that brings us to our next question, which I thought was a really good one.
So, there's no cure for the coronavirus and some people have recovered. How did they recover when there's no cure?
Yeah, that's a great question. So basically what happens is when you get sick with COVID-19, your body gets into a fight with the virus, right? So, and hopefully this fight only lasts a few days. Your immune system creates these antibodies, which are sort of little soldiers that are fighting this virus. And over the course of hopefully a few days, they learn how to beat the virus. So at that point, you have some immunity to the virus. We haven't heard of too many cases, if any at all, of people so far who have gotten sick with this twice. So what we think that means so far is that once your body beats the virus, it knows how to beat it again. Once your body has learned how to fight this thing, then it's ready and prepared for the next fight if that comes up.
Okay, and I guess the reason why some people have recovered and other people haven't is that some people have stronger immune systems than other people.
Yeah, that's a big part of it. And, of course, the older you are, the weaker your immune system. If you have other health problems, like asthma, for example, then, yeah, you have a harder time fighting this particular type of virus. We've seen issues for people who have diabetes, that sort of thing. So, yeah, if you're already sick, it's going to be harder to fight this virus if you get sick with COVID-19.
Okay, and you mentioned that older people tend to have weaker immune systems, but I just want to make sure that we clear up one thing. Can kids get the virus?
Oh, yeah, kids can get COVID-19, that's for sure. But the good news is that the vast majority of kids are actually doing a better job of fighting this virus than their parents and way better than their grandparents. So that's a bit of good news in all of this. But, we are still concerned about kids spreading this virus. And that's why we've seen schools closed, playgrounds closed, is that kids are usually considered sort of super spreaders of a virus like this one for a lot of reasons that any parent could probably imagine.
Actually, I'm going to get you to unpack that a bit more because we have a question on this.
Why did the coronavirus close my school? Why are playgrounds closed, and why am I not able to go back to school?
Yeah, we've gotten that question a lot from kids, and it's tough, right? Because schools, playgrounds have now been closed right across the country for weeks already in some cases. But the doctors and medical experts who are basically really smart grown-ups who study viruses, they say that closing schools is one of the best things that we can do to help stop the spread of a virus like this. And that's because schools are really an incubator where a virus can spread quickly. And that's particularly true when we talk about COVID-19, because children's symptoms have been so mild for the most part that children are that much more likely to not stay home sick, but keep going to school, right? Because they don't feel that bad. They feel okay. They're going to go to school. Then they spread the virus to other kids. Then those kids take it home to their parents, possibly to their grandparents. If a playground was open and you have a bunch of kids playing together, say one of those kids sneezes really close to your face and you get sick, or say a kid coughs on the slide and then you touch the slide and then touch your eye and you get sick. So it's important to keep these places closed according to health officials, even though I know it's tough.
We'll be right back. Okay, so most kids right now are at home because they're not allowed to play on the playground and school is closed. And we have some questions about the rules around being at home. So here's one.
I'm super bored at home. I want to go and get some art supplies. Is it safe for me to go with my mom to the stores?
What do you think?
Another one we've gotten a lot, and yeah, I know it's super boring for a lot of people right now. The problem is it might be tempting to go out and just pick up some new toys or some new art supplies to help pass the time and make this less boring. But doctors and health experts are asking that you really try not to do that. It's best to stay home. And that's because even if you make a quick trip to the store, say you touch a few different surfaces on the way and you end up touching your mouth or rubbing your eye, you could get sick. If your mom or dad needs to pop out to the grocery store to get things you absolutely need, that's one thing. But otherwise, it's best to remain at home. And, there are a lot of companies now, though many of them are very busy, but they can deliver a lot of these supplies, maybe, or toys to your house and just get them to leave the art supplies on your doorstep. And then you can pick it up there and just remember to wash your hands afterwards. That might be a good way to get some new toys and art supplies that means you can still stay at home.
Okay, and a really good follow-up question here, which I think a lot of adults want to know the answer to as well.
If my friend's parents go to work all day and go and meet their friends, is it safe for me to go to my friend's house and play with her when she's at home all day?
So can you go to your friend's house or your grandma's house to play?
Unfortunately, and I know this is tough, but health officials really don't want you to go and see your friends right now. They live in another household. And health officials really don't want you to go and see your grandparents right now. Go on Skype or FaceTime, Google Hangouts. There are lots of different ways where we can chat on video online right now. So that way you can still see grandma and grandpa, but you don't have to be in the same room with them. If you are in the same room with them, it's important to stay at least 2 meters apart.
Yeah, so we have a question on this too. Here it is.
Hi, my name's Bryson and I'm 6 years old. My question is, why can't I hug my grandma anymore?
Oh, man. See, now I'm just breaking hearts. Oh, that's a tough question. I mean, I have a 3-month-old baby at home and, definitely her grandparents are dying right now that they are like missing out on this little, cute baby time. It's hard, but we can't because unfortunately, we're really worried about grandma and grandpa this one. I mean, the older you are, the more at risk you are of this virus. The main thing is just to stay 2 meters away from them. So that's like 3 giant steps apart because that's how contagious the virus is. If you're any closer than that, it's possible that the virus could spread. So 3 big steps away is the closest you should be getting to anyone outside of your household. And so unfortunately, maybe you can blow grandma a kiss from there, but that's about as close as you're going to want to get.
Okay.
Yeah.
And a lot of people will be wondering this. Next weekend is Easter. So does that mean we can't see our families for Easter?
Yeah, I think it does. Extended family, cousins, friends, people you might normally have Easter dinner with. No, I mean, health officials have been asking people not to do that, to stay within your household. We got a question the other day from some grandparents who said, look, they've been self-isolating at home for 14 days. That's the golden number, right? Because at that point, after 14 days, if you haven't left the house at all, you haven't seen anybody, and you're not feeling sick, you're probably good. You don't have the virus. So this couple of grandparents had been staying home for 14 days, and their grandkids had also been staying home for 14 days. So they're thinking, well, maybe we can get together, right? Because we're both okay. And so we put that question to Michael Gardam, who's a really smart guy, chief of staff at Humber River Hospital. He says, look, there are 100 different exceptions to the rule, right? We start making exceptions to the rule. We're talking about, millions of people in this country. And if every one of them said, I hear the rules, but, and then you start opening the door to them and so on and so forth, it's just going to create problems, right? But that was sort of the message that, like, yeah, you're right. A lot of these people could probably get together and everything would be fine. But what if it isn't?
Mm-hmm.
Right? We're talking about saving lives here. And so we just need to hunker down a little bit longer.
All right, I think this is a question on everyone's minds right now.
How long do we have to stay home?
What's your name?
Foster, how many minutes are we going to be home, and how long can we go to our friend's house and grandma's house again?
Jeff, I have the same question. How many minutes do we have to be at home for?
I know, right? I haven't done the math with the minutes quite yet. Unfortunately, nobody knows how long this is going to last, right? And the bad news is that medical experts, those really smart grown-ups, say that at this point, it's not a matter of minutes, but weeks, right? Possibly months. A lot of these experts are really reluctant to try and predict the future. A couple of them have told me that it's going to be at least another 6 to 8 weeks of lockdown. So that's a lot of minutes.
And last question, Jeff. When are we going to know that what we're doing, all the staying home and staying away from our friends and stuff, is actually helping?
Yeah, hopefully pretty soon. And that's a great question because, the numbers that we see now, you turn on the news every day, you see there are this many new cases in Ontario and this many in BC and this many in Quebec. But those numbers are actually a reflection of what we did up to 2 weeks ago. So a lot of these serious physical distancing lockdown measures have only come into place in the last couple of weeks. So we'll find out pretty soon whether they're working and how well they're working. And when people talk about trying to flatten the curve, that's what we're talking about. If you think of the number of cases in Canada as a line that just keeps going up, well, we're trying to flatten that line, slow down the number of new cases each day so that we can keep up and our doctors and nurses can keep up. And so, yeah, we should find out pretty soon whether staying home from school, not going to the playground, whether all of that is helping. And I think obviously it is helping. And we'll get to see that and those results hopefully in the next few days.
Okay, Jeff, thank you so much for helping us out. We really appreciate it. And we'll talk to you soon.
Thank you.
All right, that's the show. But before we go, in case you were wondering just how many minutes are in 8 weeks, I calculated it and it's 80,640. Wait, There's More is produced by Rachel Brown and me, Tamara Kandaker. Sound design and mixing is by Stephanie Werner with help from Rob Johnston. Our editorial assistant is Michael Furtado and our executive producer is George Brown. I hope you have a good weekend, if we're even calling it that anymore. I'm Tamara Kandaker, and I'll talk to you on Monday.